Good afternoon. I'd like to welcome and introduce Dr. Robert Murphy, Executive Director of the Havey Institute for Global Health and the John Philip Fair Professor of Infectious Diseases here at Northwestern's Feinberg School of Medicine, who answers your COVID questions every Tuesday on the Havey Institute for Global Health's Facebook page. Today, Dr. Murphy will be answering viewer-submitted questions and addressing the latest COVID headlines through today, the 16th of August. We invite you to submit your questions via Facebook at any Institute for Global Health or by email at globalhealthinstitute@northwestern.edu. Leading the discussion today is myself, Sophie Bukowski, a student research assistant with the Institute. So Dr. Murphy, I'm going to start with some updated COVID statistics.
Great. Good morning, Sophie.
All right, so in the United States yesterday, some positive things. For the first time in a very long time, Dr. Murphy, we're seeing a 7-day average of cases peaking below 100,000 positive new cases. In the United States yesterday, we saw 129,000 positive new cases with a booster shot rate now peaking to about 32%. Hospitalizations have decreased by 5%, but the deaths all around the country are increasing. And in the United States, they have increased by 10%. In Illinois, yesterday, we saw about 8,000 positive new cases, but our 7-day average is about 3,500 cases. And there's been a 19% decrease in cases over the last 14 days, while hospitalizations have stayed the same. Once again, the death rate has increased by 105%. Okay, so what can you tell us about the fact that while cases seem to be going down, the death rate is skyrocketing everywhere in the United States?
Well, there's a couple reasons for that. One is that, and we've talked about it in the past, that in parts of the world like South Africa, the pandemic has already come down. Remember, this is always in this wave form. And it's been clear that for the last couple of weeks, we've been at the plateau. And now what we're seeing is the beginning of the downward trajectory. And that will continue. And the cases are going, they should plummet in the next couple of weeks. So this is a really good sign. It's happening globally. It's already happened in certain regions, and now it's happening here. That's great. So the thing that goes along with that is the hospitalization rate. So that's also coming down. So that's great. But then you see the death rate increase, and like in Illinois, it's up like over 100%. So there's a couple reasons for that. One is that people who got very ill from COVID several weeks ago or months ago ended up in the hospital, ended up being treated with all sorts of things. We know how to treat cases much better now. But most likely because of underlying medical conditions, heart disease, diabetes, other, cancers and whatever, those patients succumb to the disease. And so the average is a little under 500. And that's unfortunate, but that number is relatively low compared to the thousands that were dying per day before. So the percentage is high because the number is low. So you add to that a little bit and the percentage is much higher. And Illinois is kind of an outlier because the percentage increase in the nationally is like 13% or something. So, but you have to watch and see how the reporting is not as good as it used to be. It's being reported in lumps. And so you see, batches of these cases. So you have to look at these 7-day averages and take it with a grain of salt. But everything is going in the right direction. This wave is going down now, and we'll continue. And we'll see if there's another wave. There may, not be another wave, or the next wave will be blunted because of the number of people who are vaccinated and the number of people who've had a recent infection. They have some protection.
Yeah, that's really interesting. And this ties so closely into our next headline and our big headline, which is that the Moderna vaccine that targets the Omicron variant, which many hope that will bring down the next wave, is getting its first approval authorized by British regulators. So what can you tell us about it's now being administered in many places in Europe right now?
Yeah, that's the crazy regulatory thing that we have here. Our regulatory system is not very streamlined. And, we've been all over the place with the projections when this would be approved. This really surprised me that the Brits got out there ahead of everybody, or with several of the European countries. So they're still toying around when is this thing going to be out in September or then it was October, then it was by the end of the year, now it's back to September, and now the Brits are out in the middle of August. So it's coming. That's the good news, and Pfizer will be right behind. Even Novavax will have a new vaccine out too.
Well, that's wonderful. And now going into our second headline, the CDC is ending recommendations for social distancing and quarantine for COVID control. No longer recommends tests to stay in schools. Okay, so we've just done a massive 180 with the CDC guidelines. So what can you tell us about how this is going to not only affect the United States, but what this all means?
What this means is we're very close to the end of the pandemic stage. So this is a good sign. But what will take its place is the endemic stage. So it'll be basically like the flu. We're just going to have to live with it. You're going to take a vaccine every year, 1 or 2 vaccines every year. If you get sick, you're going to get treated. It's all very flu-like approach. But that's great. I mean, it gets to this endemic stage, and if we can keep that endemic, keep the lid on that endemic, of course, that'll be better for everybody, especially those at high risk. And those at really high risk have some options too. There's still Evusheld, the intramuscular injection. There'll be likely other treatments as well. So, this is the wave of the future. And so these guidelines now, as you mentioned, the key features, basically it's like, we got to live with it. We're not going to bother to mitigate anymore. No screening, routine screening is recommended now. On the other hand, if somebody is sick, they need to get tested. And the testing is going to be a key part now of when you get in and out of isolation, if you do get it. And people are going to be getting COVID over and over again. So the guidelines now say, well, if your area has a very high rate, then you have to go backwards in the mitigation process. In other words, you may have to start mandating masks or social distancing if your region gets a peak. And then when the peak goes down, that will also, that will go away. So there's some flexibility in here. And as for testing is concerned, there's been some recent data that show that people that test positive with the antigen, that's the rapid test you get in the pharmacy or that has been mailed to you by the US government, those tests are pretty good at predicting who's not contagious. In other words, if that antigen test is negative on day 5, when you test yourself for day 6, there's a very good chance that you do not have infectious virus and probably do not transmit the disease. If the antigen test is positive, it can go either way. You can be contagious or not contagious, but you always play it safe. So if your antigen test is positive, you have to assume that you're still contagious. So there's quite a few people positive after 5 or 6 days. So that's I would say that if you're still testing positive, you should still be not necessarily in isolation, but you need to be wearing a good mask and staying away from immunocompromised people and not really being out in the public.
Yeah, absolutely. And now for our third and last biggest headline and our monkeypox dose of the day is that the first suspected case of human to dog monkeypox transmission leads CDC to update guidelines on the virus. I mean, they updated guidelines so quick. What can you tell us about what's going on in France right now?
Yeah, so now dogs have it, and actually the monkeys are not carriers of this virus. They were laboratory animals. I don't know how they got monkeypox, but the monkeys got it, and it was a different virus, and but they don't carry it, and so that's kind of, they got blamed for this pox disease, even though they're not the carriers. They were like the victims of that first case in Denmark years ago. So and now dogs got it, and we know, COVID also is out there in animals, and these viruses go back and forth with the animals, which makes it even harder to control. So a couple things are happening. One is that the WHO is probably going to change the name. They're not going to call it monkeypox anymore. Already there's two different kind of strains. So the Central African strain, they're going to call clade 1, and the West African strain, they're going to call clade 2. And then they're going to change the whole name. It's not going to be monkeypox anymore, but they're deciding on the name now. So that hasn't actually been chosen yet. The other big news with monkeypox, there's a lot of news items. The US government just ordered $1 billion worth of monkeypox vaccines, and they've changed how the monkeypox vaccine that we have can be given. If they give it intradermal, which is like how you get a TB skin test, you can use 1/5 the dose and have just the same immunologic response. So the amount of vaccine we have would be 5 times bigger. That would be great. Now, not everybody knows how to do an intradermal injection. It's just like, you can't say give it intradermal if somebody's never done that. Because especially in the United States, we're not doing many of those TB tests anymore. They do the quantiferin and gold, they do the blood tests. So anyhow, you have to be trained to do that, but that's increasing the supply. And this new order of vaccines has come in. And so, again, just like with COVID, once the supply chain gets worked out and the production ramps up and more efficient ways to administer the vaccine, this is great. More and more people will be vaccinated. The other thing that's happening is there's a study just very recently, I read it this morning, about checking in wastewater for monkeypox. And in a report out this morning, in 6 of 10 states where they looked, they didn't look at the other ones, so this is just like a subset. 6 of 10, they found monkeypox. So monkeypox it's endemic now in the United States. And they do this for other viruses as well. They do it for polio and many other pathogens. So it's out there. It can be controlled. There is the vaccine. It's coming. The production is up. The administration is becoming more efficient. And so you watch in the next few weeks, most of the people that need the vaccine should be able to get it.
Wonderful. Well, and now for some of our COVID questions. The first one is, I tested positive on Friday, August 5th. I started Paxlovid that day. On Monday afternoon, I started having terrible back pains that continued later in that week. I also noticed a small lump on my right collarbone. Can any of these things be related to COVID, to Paxlovid, to anything related to COVID?
Yeah, so just having muscle pains and aches and stuff can be related to COVID. I'm not sure if this has anything to do with Paxlovid, but COVID can definitely do that. As far as the lump on the collarbone, that doesn't sound related to either COVID or the medication, and that, you should see a doctor and see what that lump is. I mean, that's really the only thing I can say about that particular case. This person is already done with the Paxlovid, most likely. That's good because that will help them. And yeah, really nothing more to say there. So I think the aches and pains, yes. The lump, no. Go get the lump checked out.
Wonderful. And our last COVID question, and one that I feel like we receive on a weekly basis, Dr. Murphy. I'm fully vaccinated and boosted. I tested negative Thursday morning, but had a cough all day. I tested again on Friday morning and actually then test positive. Can you tell me how early that week I may have been contagious?
Yeah, so it really starts 1 or 2 days before your first symptom. Remember, these antigen tests are not that sensitive early in the infection. They turn positive, obviously, eventually. In this case, it was 24 hours later than after they started getting the symptoms. But most likely this person was, so they tested negative Thursday, and they had symptoms that day. So they were probably contagious Tuesday or Wednesday. So I would assume that. And then they'll be positive, for at least 5 days from the day of the first symptoms, not the day of the first test being positive, unless that happened before the symptoms started. And they'll be contagious. And now with the new guidelines, they're saying, well, if you can get the antigen test, you should do 2 tests separated by at least 24 to 48 hours. And if they're both negative, you're free to go and you're not contagious. So that's basically how you use those tests. Now, there's even another study showing you should do 3 tests. Well, of course, 3, 4, whatever. You can do them every day, but at least 2, and maybe even consider 3. And when you get 2 in a row that are negative, you can basically get out of isolation and get back into the community.
Well, Dr. Murphy, those were all of our COVID questions for today. Thanks for tuning in, and we'll see you next Tuesday.
Okay, great. See you next week.